Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine we put together here at the Virginia Institute for Public Policy so that you're better informed when you start hearing people that have just spent a little too much time in the echo chamber. We've got a great program for you this autumn weekend, and we kick it right off with one of our favorite publications, Reason Magazine, the Reason Foundation. Vittorio Nastasi is on with us, and we're going to talk a little bit about health care and some of the ways we can get government off of health care, not more involved into it to make it better. Vittorio, thank you for taking some time out for us this weekend on Freedom and Prosperity Radio. How are you doing, sir?
I'm doing well. Glad to be here.
So your columns talk about things we can get the government to stop doing, and that's always the first place I want to look. I don't want to look for the government to add more things. I feel like a little bit our country becomes like that piece of furniture that's been shot with the cheap furniture wax one too many times and is starting to look a little cataracty on it just with the waxy buildup. So you're talking about taking away restrictions on letting nurse practitioners expand healthcare access. Tell us what you're proposing.
Yeah, so the country as a whole is facing a looming shortage of physicians, projected up to 122,000 physicians across the country. And one way of trying to address that shortage is by allowing non-physician providers to take on some of the roles that a physician might typically serve in. And so that can mean expanding the scope of practice, which means the range of services that a nurse practitioner would be allowed to provide, or simply just reducing some of the licensing barriers to allow a physician to practice in multiple states or to allow nurse practitioners to cross state lines, as well as a number of other regulations that sort of impact the healthcare market.
Now, of course, you're not talking about asking nurse practitioners to do things they're not trained in the first place.
Absolutely, right. So I don't mean to diminish the role of physicians because certainly they are the highest trained healthcare practitioners. However, there are lots of services that regulations require to be provided by a physician, or at least under the supervision of a physician, that nurse practitioners, other types of advanced practice registered nurses are able to provide, and typically do. A lot of these things are things that nurses are already doing. They're just doing it under the supervision of a physician, which doesn't necessarily mean that a physician is even in the room or actively supervising the nurse practitioner, more that the physician gives the final sign-off on something, or just is there in sort of a it's something that's required by licensure, but it's not necessarily what people imagine when you say the word supervision.
Well, and as pretty much anyone who's probably gone to a medical appointment in the last 4 or 5 years as the HMO world has evolved, knows exactly what you're talking about. If they're there for an hour, they see a nurse practitioner for the lion's share of it and maybe get 5 minutes with the physician that's eventually going to sign off on their paperwork. I mean, even things as complex as orthopedics are being pushed off as these schedulings. I had an orthopedic surgeon tell me that he's allowed by the hospital he's associated with to spend 7 minutes with each patient by their scheduling. I mean, they'll set him a schedule that only allows him 7 minutes with each patient. So even something like an orthopedist is spending less and less time with the patient. So this isn't something that we're inventing out of whole cloth. This is going on right now.
Exactly. And, it's important to remember that advanced practice registered nurses, nurse practitioners, these are highly trained healthcare providers. They go to graduate school. It's not just a 1 or 2 year nursing program. That's a registered nurse. So there are some additional requirements to become an advanced practice registered nurse or nurse practitioner. And lots of states are already allowing nurse practitioners to practice without physician supervision. Virginia actually does have a process where nurse practitioners can practice free of supervision. But there's a period of about 5 years that a nurse practitioner would have to work under physician supervision before being allowed to work on their own.
Now, is that a state regulation or federal regulation, Vittorio?
That is state level.
So these are things that our General Assembly can be working on, even while the tumult that is Washington, D.C. goes on. These are things Virginia can be created in. What do they like to call it? The incubators of democracy in the state laboratories of this. We can create a scenario where it seems like this would be a scenario where even one of the things that was one of the fulcrums of Obamacare was, there's the old country doctor's gone away, the hospital, the country doctor, the small town doctor has gone away, really under a lot of insurance regulations, forcing them to close up their small offices and create co-ops. But would this help at least bring back health care for rural communities?
Yes, and this is one of the major motivations for these state-level reforms is that particularly rural areas have a hard time attracting physicians because there's not enough population density for them to be able to serve a lot of patients. And so one of the objectives of allowing nurse practitioners to work on their own is that they would, potentially go out to rural areas and not have to be working under the supervision of a physician because, typically when there are supervision requirements, they have to be co-located. And so if there's not a physician in a rural area, then, by requirement, you can't have these nurse practitioners in the area as well.
I know that a lot of the nurse practitioners in our flagship area have actually risen to that position from, a very direct 2-year, nursing degree through a community college, getting working, then through that work, studying further and continuing. So it's not even an academic pursuit as much as it is almost a blue-collar pursuit where they become nurses, they get their first nursing certifications, and then grow in the field through their doctor's offices. Is this something we can do more to foment, Vittorio?
Yeah. So explain to me more what your
the most of the nurse practitioners that I know in the area here started out as just registered nurses, get their nursing degree from the community college, and then as they worked in the field, the doctors that they worked with, the medical facilities they worked in, whether it be a hospital or a doctor's office, were paying for them to continue their education and grow in their field until they wound up in some cases even going beyond nurse practitioner and getting a full medical degree.
Yeah, I mean, so, a registered nurse license is about a 1 or 2 year program that you can do at a community college. And then, yes, you have to be a registered nurse before you can become an APRN, and that's typically the course that somebody would go.
But what I was asking is can the Commonwealth do more to promote that idea, whether it be through tax incentives, scholarship availabilities, things like that, to help where a doctor might say, hey, I've got a really good registered nurse here. I want to help them grow in their field, and they're going to become a bigger asset to my medical practice as well, and help them kind of promote that idea of growing professionally once they're in the business, as it were?
Yeah, I think that sort of thing is definitely possible. I think really the best way to try to promote expanding the number of advanced practice registered nurses would be just to limit some of the requirements that are in place to become one, to actually receive that licensure. And, there's a lot of incentive for nurses to pursue higher levels of licensure because as you become higher trained and have these higher level licenses, your income does increase substantially to the point where nurse practitioners and APRNs are compensated near the levels of some physicians, depending on where they're practicing and what their specialty is.
Vittorio Nastasi is on with us, policy analyst with the Reason Foundation. Read his stuff at reason.org. He's written extensively about nurse practitioners, and the field could do more to expand access to health care through deregulation of all things, Vittorio, and that's always the direction you want to be going. Is this... talk about percentages. How much of our medical interactions are things that, based on training and licensure and insurance coverage and all of that, how much of our medical interactions actually need an MD involved and in your analysis could suffice with a nurse practitioner?
So there's a report from the former Congressional Office of Technology and Assessment that concluded that as much as 75% of the well patient care for adults and children could be provided by nurse practitioners. And so that, encompasses a large scope of things, but that is, again, well patient care. Mm-hmm. So, there are definitely circumstances where you would want to have a physician where a physician is necessary. But when we're talking about well patient care, things like checkups and, standard doctor's visits, that sort of thing can certainly be handled by nurse practitioners or other forms of APRN.
Now, you read most of the literature from the health management organizations. That is what their goal is. Is to have you do more well baby and well care management visits so that you don't need the medical care. Is this something the insurance company is behind, and in for, or are they, what's the right word I'm looking for all of a sudden? My screen went blank in my head. Or are they pushing back against the idea?
I can't speak to the position of insurance companies, but I can say that, yes, what you said is true, that generally doing more well patient care, going in for regular checkups, that sort of thing does have measurable health benefits. And that's why in a lot of states that have expanded the role of nurse practitioners, you do see better healthcare outcomes as well. And so, a lot of these regulations exist to protect patients, but actually, to the extent that you make it easier for people to receive care, mm-hmm. you tend to see better outcomes over the longer term. So I would imagine a health insurance company would be in favor of that. But, there's also a lot of influence coming from the physician lobby, which is very much opposed to, expanding the role of nurses relative to physicians.
Are they doing it out of the simple, protecting their piece of the pie, or are there other reasons they would be against the idea?
Well, there are some studies that have found that in places where nurse practitioners play a larger role, they tend to be compensated more and physicians compensated less. And so there's definitely a financial motivation for physicians to be against this. And, like I said, I don't mean to diminish the role of physicians. They do play a very important role. But again, there are lots of things that nurses can do, and claims that it wouldn't be safe just are not supported by the broader mm-hmm. Research on the subject. Most studies that look at this find that outcomes are comparable or better. Patient satisfaction for care provided by nurse practitioners tends to be higher than from physicians. And so, I have not been able to find substantial evidence that there are any negative repercussions to expanding the role of nurse practitioners.
And you mentioned earlier on that Virginia does this better than other places in the country, but what are some of the things that Virginia could do better in the world of making it more likely that a nurse practitioner can handle a heavier load of the health care than they currently are, so that the access would grow?
Well, there are two things that I saw as I was looking through Virginia's statutes. One is that while nurse practitioners in Virginia may apply to work autonomously after 5 years of working under the supervision of a physician, that does not include other types of APRNs like certified registered nurse anesthetists or certified nurse midwives, which in other
Really?
states are allowed to practice autonomously. So only certain nurse practitioners in Virginia are allowed to practice autonomously. So the state could look at expanding autonomous practice to those other types of APRNs, and that would be beneficial. And second, there's still an issue of scope of practice, which refers to just the range of services that a nurse is allowed to provide. You would have to dig into the Virginia regulations on nurse practitioners, more likely than statute. So there, I don't know exactly the procedures that nurse practitioners are qualified to do in Virginia, but it would certainly be worth taking a look at exactly what the scope of practice is in Virginia relative to other states. And I would generally recommend going for the broadest scope of practice possible.
One of our favorite. Go ahead. I'm sorry, Vittorio.
Of course, to the extent that nurses are trained to do those things. You don't want to go beyond what a nurse is trained to do. But as long as a nurse has been trained to do something, they should be allowed to do it on their own.
One of our favorite acronyms here on this program is CON, as in Certificate of Need. And I can imagine that is going to be, even if we were to say to, and this is so typically Virginian, it's not funny, that they would say, well, we'll certainly allow nurse practitioners, but you still can't open your office because we have Certificate of Need laws. So certainly in order to do what you're proposing, we would have to relax that as well.
Yes, Virginia has a very extensive Certificate of Need program, and it covers a very wide array of healthcare facilities and services. So that is one area of healthcare regulation that Virginia should definitely pursue reform on. Lots of other states have begun to repeal their Certificate of Need requirements. And as we've seen with the COVID-19 pandemic, lots of states have temporarily suspended con regulations on hospital beds, on hospital capacities. They've all relaxed these licensure standards to allow nurses from other states to come in, or to allow the nurses that are there to do more things. So yes, I mean, there's plenty of things outside of nurse practitioner licensing that Virginia should look at. I would also recommend looking at telehealth services, making it a little bit easier for out-of-state providers to provide telehealth services remotely to patients in Virginia.
Two of the things that may be the lasting remnants of COVID-19, once hopefully the virus itself is in our rearview mirror, Vittorio, is that we've learned these things about healthcare. Is that medical attention is not just get me a doctor now. Are there other things that we've learned about medical care versus get me a doctor that will carry over past 2020 and beyond?
Yeah, I mean, I think the lesson is that when you have lots of stringent regulation that tries to basically determine what the appropriate number of facilities are, or have to go through an extensive approval process to get a license or to open a hospital, those things are important to, make sure that things are of high quality, but they can also, hamper any ability to respond to a crisis or not respond to, real needs in the market outside of that. And so I think the lesson is just that we need a little bit more flexibility in our healthcare regulations, in the licensing processes, et cetera.
Is an abstract to this, Vittorio, that I recall, and I'm probably much older than you are, though I still don't quite believe that of myself, but I was growing up through the 70s, and we went 3 blocks in our neighborhood to another house that looked just like ours, but the ground floor of it was our doctor's office, and we saw him there. And if we needed something beyond that, he would say, "Oh, all right, we're going to have to go to the hospital, 10 blocks away," that kind of thing. Have we shrunken the footprint of the medical care world and therefore made it more structured and fracturable and brittle because we don't have those neighborhood doctors. I mean, I wasn't in a rural area. I was in a fairly large city, one of the largest in the world, and there were doctors' offices every five or six blocks. It seemed. Have we centralized too much in your mind?
Yeah, I mean, I think the regulatory framework here is both a cause of and a product of, advancements in or changes really in the way that healthcare is delivered. Some for good and some for bad. I think it would be nice to have greater accessibility to healthcare, and regulations do prevent more innovative approaches or specialized approaches. Things like a neighborhood doctor just wouldn't really be as feasible under today's framework. I think trying to allow as much flexibility as possible is really the best outcome here. And so, that's been a detriment of the current framework.
And do these emergency care businesses that we see popping up, the MedRx and places like that, talk about their impact on this, and would they benefit as well from, a greater aspect of nurse practitioners' ability to, serve the public without necessarily, having to be attached to an MD?
Yeah, well, I mean, that's the sort of structure that you'd like to see out in rural areas, is to have more clinical settings that could be run by a nurse practitioner without necessarily having a physician supervising. I don't know if it'd be exactly like an urgent care or something like that, but certainly in rural areas, it would be preferable to see nurse practitioners going out and opening their own practices in those areas without having to have, a hospital or a full-fledged physician's office. And then for things that a nurse practitioner can't do, they can, of course, reference a patient out to a physician who could handle more specialized things. But for the vast majority of well-patient care, a nurse practitioner could handle that in a smaller setting.
And I imagine, the American Medical Association is, hell-bent against this, as well as many of the doctors would be, or are they on board with some of these reforms?
No, the AMA is strongly opposed to expanding the role of nurse practitioners.
Yeah, see, because I don't think it's the American Doctors Association. I thought the acronym was for American Medical Association, which would imply that it's all medicine. But, what do I know? Vittorio, thank you so much for your time this week. Policy analyst with the Reason Foundation, Vittorio Nastasi. What are you working on next for Reason.org?
Keep writing about healthcare. Right now I'm working on some additional research that related to Florida that should be out soon.
Well, I know that some places have been doing better than others at reforming the idea, so keep us up to date on that, and we'll hope to have you back on again real soon. Thank you so much for your time this weekend.
All right, thank you.
You can find out more about him at Reason.org as well. Coming up next, new movie out, Trump Card. The author of the book it's based on and the producer of the movie, Dinesh D'Souza, next on Freedom and Prosperity Radio.